Okay, I'm going to go ahead and get started. Like I said, I want to respect your time. So welcome everyone. My name is Mariah Bruner. I'm UCS Wellness Coordinator serving faculty and staff. It's so great to see everyone today. Just a few housekeeping items before we kick this off. You can get 5 lifestyle rewards for attending today and just stick around until the end and I'll give you information about how to claim those points. And then also I'm going to leave plenty of time at the end for questions. So if you've got something, you can put it in the chat or just hold on to it until the end. I'm driving by myself today. I don't have anybody co-coordinating this session, so it's a little bit hard for me to do both. So I will get to those questions. Just go ahead and put them in the chat if you would. So these are the learning objectives for today. By the end of today, I hope that you learn what to expect during your biometric screenings. You understand about biometric health scoring and our BeWell health insurance premium incentives. And then also we're going to explore some ways to improve your overall health before your biometric screening. And as I teased in the marketing of this program, we will have biometric screenings coming up starting May 10th. So we're about 6 weeks away from those first options to screen on site. And so that's why we wanted to do this session, just kind of give you all a heads up, let you know what to expect, and then help prepare for that screening. So first of all, why complete a screening? There's a few reasons. First of all, screenings offer eligible faculty and staff the opportunity to understand and manage their health. Every year, we have faculty and staff members that identify health issues through the biometric screenings that they did not know that they had. Typically, that is undiagnosed prediabetes, that's high cholesterol, and that's high blood pressure. They're just unaware. And that happens, right? We all get busy. We maybe don't make it to the doctor as much as we should. And so this provides a really convenient opportunity to get just that snapshot of your health. And they also serve as one of the 2 activities completed annually to earn your health insurance premium discount for the next calendar year. And so just a reminder, we always hope that you participate, but of course, participation is completely voluntary. So just keep that in mind. So let's talk a little bit about the health insurance discount. I know that's usually a popular topic and a popular motivator. So we have to do 2 things to earn that insurance discount. It's not just the biometric screening, it's also the health risk assessment survey. That's a very easy survey. It takes like less than 5 minutes to complete. And that's available after your biometric screening results are processed. You'll get an email from Health Check 360 letting you know that that's available on your portal. But I just wanted to make sure that that was clear, that there's actually 2 activities to earn that discount. And that discount right now, it's $20 or $40 per month, depending on your health score. That's the same as last year. And we'll talk a little bit more about scoring here in just a second, but that's just an overview. And then just a reminder, our program year is November 1st through October 31st each year. So I always say an easy way to remember that is Halloween. So by Halloween, make sure you get all your activities completed and submitted on your portal, and you'll be good to go. So a little bit more about what to expect. So like last year, we have fabulous partners at the Student Health Clinic. On-site screenings will be offered there starting May 10th all the way through the summer through August 13th. That's a month more than we offered last year. We started them last year in June, and this year our colleagues at the clinic were nice enough to open up an additional month of availability, which is awesome. It gives you more flexibility, gives us a little bit more of those morning appointments. People love those morning appointments because of the fasting requirement. So lots of flexibility and availability will be coming up for those on site. And I will be giving you all the details in a couple of weeks. Don't call or email them just yet. We're still setting up the scheduling on that and just kind of working out final details. But information will be going out to all of you soon. I promise you won't miss it. And then there's no cost. So this is a great way. There's no fee. It's great. It's convenient. You can go on site. You don't have to pay anything. There's no copay, anything like that. No cost to you. And the folks at the clinic are super organized and efficient, and you'll be in and out in under 15 minutes. And then of course, just a nice reminder, since we all work here and like a little work-life separation, all of this is confidential. So the student health clinic, they abide by HIPAA, just like any other health clinic. They are committed to ensuring the privacy and security of your protected health information. And for me, I don't see anything in my office except for yes or no, you did a screening, yes or no, you did a survey. I don't see your score. I don't see any of your health information. That is kept completely confidential. Couple other things to expect, and I get asked these questions a lot. So you'll want to fast for at least 4 hours prior to your appointment. You're going to want to drink plenty of water. And then we're not really sure what the future looks like, but I'm fairly certain in May we're still going to have those COVID pre-screenings prior to admittance to the clinic. That, of course, is not only to protect you, but also any other colleagues that are at the clinic at the same time, and as well as the staff. So we want to keep everybody COVID safe. So please do wear a mask to your appointment, and also bring your UCA employee ID card or your BEAR card with you to the appointment. So during the appointment, you will remain fully clothed, but just keep in mind that there's certain parts, body parts, that we need access to. So you're going to need to your height, your weight, your waist circumference. Your waist circumference is going to be measured with a tape measure. So kind of comfy clothing is a little bit better, I would say, for that. We will need access to your middle arm for that blood draw, and then the blood pressure, of course, is a little easier if you don't have real thick clothing on. So just things to keep in mind. You can wear whatever you're comfortable with wearing to work that day, but just some considerations for your clothing. But again, height, weight, waist circumference. They'll take a blood pressure reading. A quick note about blood pressure. Some people ask about this. So sometimes we have white coat syndrome, or maybe we rushed to the clinic because we were running a few minutes behind. And that first reading might be a little bit high, and that can be normal. That's to be expected. So if you prefer, you may ask the technician to do a second reading, and they will do that. And then they will record the lower of the two. So we allow up to 2 during the visit. So just so you're aware of that, you are more than welcome to request a second reading. Blood sugar, we do a finger stick, and then a blood draw. That's just kind of the standard venipuncture. Just they'll take a little vial of your blood and send that off to the lab. And then we also do collect a urine sample for your analysis. All right, so with those lab tests, these are some frequently asked questions. What exactly are we running for? So we do a standard panel of tests. And again, we want to give our employees a pretty good snapshot of their overall health. So we test for things we test for organ function. So we're testing for different metrics for kidney, liver, and other organ function. We are testing for your risk of heart disease, which is measured by your levels of HDL and LDL cholesterol, as well as your triglycerides. And then we've added a couple of optional tests, and we have the option to test for these, and we do go ahead and do that again, just because we want to give the most comprehensive snapshot of your health. For males, assigned sex males age 40 years and older, we do prostate specific antigen testing. And then for anybody who has a finger stick and that reading comes back at 110 or higher, we will go ahead and run what's called a hemoglobin A1C test. And that's just a measure of, it's kind of like an average of the last 2 to 3 months for your glucose levels. We don't have many employees that get that, but there are about a dozen every year. And that just kind of, again, just goes the next level and make sure everything looks good. Or if it doesn't look good, that we can notify you about that. All this information, of course, is always available on our website, uca.edu/BeWell. We've got a tab there that has all this information about what we're testing for. And so I encourage you to take a look at that if you have more questions. And then it's important to note that we do not score on all of those things that we're testing for. Again, part of the screening is really to give you an overall good picture of what your health is looking like at the time of your screening. But these are the indicators that we are actually scoring on. So there's 9 metrics. So there's the body mass index, waist measurement, excuse me, blood pressure, your cholesterol ratio, your HDL cholesterol, your LDL cholesterol, your triglycerides, glucose, and then your nicotine status. And I know these numbers are really small. And again, this is available on our website if you want to take a closer look later. But you can see that some of these are worth more than others. So big ones are nicotine, glucose, and blood pressure. Those are each 20 points each. So it shows you how just a minor improvement in your health can really impact these scores. And that should be seen as a positive, as an opportunity to really make some changes if you're ready to do that, so that you can improve that score from last year or for the first time, if you're doing it for the first time. So for health scoring, our standard tier premium incentive, so our standard discount for the health insurance, as long as you just participate, so it doesn't matter what you score, and you do that survey, you're going to get $20 a month. If you complete the screening and you score a 75 or higher, or you improve by 5 points from last year, you can bump up to that gold tier, that $40 per month discount. So we've got some options there, some incentives to improve year over year. But this just gives you, I wanted to put these side by side because I wanted you to see how your health sort of plays into this scoring, and again, how those minor changes, these little tweaks to our overall health can really impact the score. So talking about improving health score, we should also just kind of put this disclaimer out there that you should always talk to your doctor before making any drastic lifestyle changes. That's so important. And remember that telehealth, with the expansion of telehealth, our doctors are just a voice, a FaceTime away, really. And so it's easy to access your provider. So if you have questions about how to get started, if you're not really sure that's right for you, or how fast you should ease into that process, just contact your doctor. They'll be happy to talk with you about that. The other thing is taking prescribed medications and following doctor's orders. So if you have not been completely compliant in the past with medications that you've been prescribed, or just some protocols that you need to be following for condition management. So I'm talking diabetes, prediabetes, high blood pressure, high cholesterol, those types of things. Now's a good time to get on those medications that you've been prescribed, or follow those more, or be more compliant with that regimen. And then just be following any other instructions your doctors are giving you. Because if you are on those medications and taking those medications regularly, and you need those medications, then that will give you a better score, especially if it's helping you manage those higher score options like blood pressure. And then let's talk about SMART goals. So we've all heard the I'm going to get healthy this spring, right? Okay, well, that's great. That's a positive attitude. That's a great mindset, but that's not a plan. So we want to be really intentional about setting those wellness goals. And we've got a great worksheet BeWell does on our website, uca.edu/BeWell, on our resources tab. And it's just a real simple worksheet. It kind of explains what a good SMART wellness goal looks like step by step, and then helps you work out that process for you. And SMART, of course, stands for specific, measurable, action-oriented, realistic, and timely. So it kind of frames things for you, personalized for you, and really lays out what you're seeking to achieve. And you'll be more successful in that. So as you're thinking about planning for your biometric screening, this is a good time to establish those really intentional outline goals, so you can track your progress and really have a deadline for yourself. So again, talking about improving your health score, keeping the SMART goals in mind. These are some things that you can do to improve your score. So right off the bat, you can quit smoking and you can stop using nicotine products. Easier said than done. I totally get it, but that's 20 points right there. So if you screened last year, and of course you didn't score that top, quit smoking, boom, you're up 20 points. So that's automatically going to bump you up to that gold tier, that $40 level. So that's a great improvement to your health. Of course, getting moving, just increasing your activity level. This does not necessarily need to mean that you're going to exercise full force for an hour every day. I'm talking just getting out and starting to walk 5-10 minutes a day if you're not moving at all. Structured exercise is great, but other things just like playing with your kids outside, gardening, doing housework, things that just get you moving are really, really important. And so find ways, find creative ways, find things that you love to get moving. And then you're going to want to take a look at your diet too. So reducing sodium, saturated fats, trans fats, and sugars, of course, will help with lots of different metrics. And then adding more fruits, vegetables, whole grains, and other fiber-rich foods, and then those healthy fats is a great idea as well. And then limiting or avoiding intake of alcohol. So lots of things to do. Again, these are very general, but you're going to want to kind of dive deeper and really specifically say, okay, what are the things I can do in all these categories to improve my score and overall health, and that really what meets your needs and what you want in terms of your goals. So I love this question. So what's possible in 6 weeks? There's a lot that can happen in 6 weeks. So do not underestimate the power of getting on track between now and May 10th, or whenever you choose to do your on-site screening. Weight loss, a healthy weight loss is 1 to 2 pounds a week. So even if you were to screen on May 12th, 6 weeks, you can lose between 6 and 12 pounds healthy between now and then. And again, just that disclaimer, if you're not active at all right now, haven't been healthy for a while, you might want to talk to your doctor before doing that. But a healthy weight loss goal is 6 to 12 pounds between now and beginning of May. That is absolutely attainable. You can easily lower your blood pressure with getting active and improving your diet. Studies have showed that from time to time, in as little as 1 to 4 weeks, that can improve your blood pressure. So again, just a few notches on that blood pressure reading can bump up your score. Cholesterol levels. This is a little bit harder. Cholesterol is one of those things that takes a little bit longer. So if you change your diet, eat healthier, usually takes about 3 months to see improvements. But I will say that the HDL, so that good cholesterol, can be drastically improved. So you want the HDL up and you want the LDL down. The HDL can be greatly improved with increasing your physical activity. And so I will say that's one of the areas that you see employees have to work on as a whole. And especially with the pandemic, we've all been sitting, we're on Zoom all the time. And so just getting out and being active in whatever ways we can will help increase that HDL. And again, the higher the number on that metric, the better it is, and that'll increase your score. Lowering triglycerides, an easy way to do that, not a lot of people know this, is alcohol consumption increases your triglycerides. So if you decrease your intake of alcohol, that will improve your triglyceride level, as well as a number of different things that you can do with your diet that I suggested on the previous page. But that's just another metric, something else to consider. And then glucose levels, of course, getting that diet in check. If you are already pre-diabetic or diabetic and sort of had a plan and how to control your blood sugar, now's a great time to put that plan into action, healthier eating, getting all that physical activity in. So we also need to talk about support, because none of those things are necessarily easy if we're just starting out. And so, of course, BeWell always is a fantastic resource in linking you with all these great things that we have on campus. And then we also have virtual resources. So if you need support, visit our website again, uca.edu/BeWell, our resources tab. Y'all, there's such great stuff on there. I've carefully curated just such a great amount of free resources on there. So if you are looking for health coaching, Health Check 360s, telephonic health coaching, it is free to you to use. You go on this website here, you can get connected with them, or just shoot me an email on any of these. If you want to get connected and you can't find it on the website, you just email me. We have a campus dietitian. His name is Nathan Slinkard. He works with Airmark, but he is here to serve UCA students, faculty, and staff completely free. He will meet with you in person. He will meet with you virtually, whatever you prefer. He will find out what your specific goals and needs are, dietary preferences, dietary restrictions, things like that. and he can help you come up with a really tailorized plan for you. Hypercenter, y'all, this is such a fantastic resource. Other universities charge their faculty and staff. We do not. It is free to use, so take advantage. We've got the wonderful fitness center, the pool, the group X classes, just awesome. So take advantage of that. They have personal training. It's not free, but their charges are very reasonable. And even just 1, 2, 3 sessions, if you're really unfamiliar with using the facility, they can help you just kind of learn the equipment, how to safely strength train and use all the free weights and the weight machines, and just navigate, sort of that unknown territory if you're not familiar. So definitely take advantage of that. If you're looking for smoking cessation or help to quit smoking, there's something called BeWell Arkansas, which is kind of funny because it's not related to our BeWell, but BeWell Arkansas, it's a state program, it's free, and they provide coaching specific to quitting smoking. So take advantage of that. And then, of course, it's worth mentioning that sometimes our health is really tied to our physical health is tied to our mental health. Okay, so if we are just having a really hard time controlling stress or other areas of concern in our lives, sometimes we just need to go to a counselor and talk it out and get some support there. So we've got the employee assistance program, which again is free to employees. So take advantage. You can get some help that way. Again, it's on our website. You can contact me. I'm glad to get you connected. And the great thing, you can do in person, you can do over the phone, or you can do a virtual video conference. So they will meet you where you are, literally, to meet that need. So these are just a few of the things we have available that I wanted to make you all aware of. So let me see if there's any questions in the chat. Let me check the chat real quick. I don't think I have anything, but I will open it up at this point. That was a lot of information, I know. So you can unmute yourselves or put things in the chat. Any questions?
Mariah, this is Penny, and I do have a question about the blood pressure readings. I'm going to try to figure out how the best way to say this. Do they do it manually, or will they do it like, where you just stick your arm in and it's sort of electronic? Because it seems like mine differ a lot with those two different kinds of, does that make sense?
It does. That's a great question. So Penny's question, for anyone that maybe didn't hear, Penny asked if they were going to do a manual reading. So they literally like put the cuff around your arm and then kind of do the squish, 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 and then listen with a stethoscope. Or is it more of like a mechanical reading that's an automatic? I have asked the clinic to do manual when possible. So I know that they get busy and things like that, but I have asked them to do manual because usually those are a little bit more accurate. But I will say, you can also just let them know your preference when you walk in. If it doesn't matter to you, then don't worry about it. But at Penny, if you go in, you'd really prefer them to do a manual, please just let them know that you'd prefer to do a manual. They're happy to do that. And like I said, even if maybe you kind of aren't paying attention and they do an automatic and that reads a little higher than what you're used to, just go ahead and say, hey, you know what, that seems high. I'd like to do a manual on my second time. So I say that there might be some variability to that, just because I've run a clinic before, and I think things get busy and different technicians do it different ways. So really just kind of have an idea of what your preference is, and they should be able to honor that. So I hope that answers your question. I think there was something in the chat. Oh, Brittany says great information. You are welcome, Brittany. Okay, Penny, great. Anybody else?
Mariah, I have something.
Yeah.
In front of this group, I just want to give a shout out to Mariah and all the hard work she does with BeWell and meeting the needs of our employees and wellness initiatives. I have really been impressed since I've been here, and I'm just really excited about all the work she's doing. And every day she's trying to think of ways to help us. And so I just want to give her a public shout out. So thank you, Mariah, for all your hard work. We appreciate you, and we see the hard work you're doing.
Thank you so much. That was really nice. Made my day. Okay, I have to continue on. I have to absorb that and continue on. Let's see, where can we find information on lowering cholesterol? Oh, great question. That was from, it looks like Malcolm. Malcolm, Dr. Alicia Landry did a fantastic webinar a few months back on eating to lower cholesterol, and that is also linked to our resources page, or you can go directly to our YouTube channel. If you aren't quite familiar with that process, just email me and I'll get you a link directly to that. It's a great webinar. She did a great job. It also touches on everything. So HDL, LDL, and triglycerides. She did a great job. Okay, y'all, I'm going to continue on just to the lifestyle rewards part so that we can move on to the rest of our day. I know some of you are probably waiting to go to lunch. So let me get to that screen. Hold on just a second. There we go. So the easiest way to claim your points for today is just to take a screenshot or a snap or photo on your cell phone if you use the app. And load that up to your portal using the BeWell Education Session Support Groups and Resources Groups category. If that sounds too confusing to you, just email me and I'll send you a certificate of attendance and you can load that up. So whatever works for you. I'm going to leave this up on the screen and I'm going to go ahead and officially adjourn for today. But again, I'm going to stay on the call for a few more minutes. If anybody has any other questions or concerns, I'd be happy to answer them. So thank you all for joining us today. Have a great Wednesday.